Senator Steele-John, once again, incredibly well-spoken as you stand up for so many people with a disability. But again, a shameful performance by the government as they continue to refuse to provide this Senate's demands to give us the financial modelling that underpins capping the growth of the NDIS. Now, most people who don't live daily around the NDIS, who don't rely on the NDIS, I don't rely on it as a disabled person, but I rely on it having a son who is a participant. And I need to know when I'm not there that my son is going to be looked after. I need to be secure, to Senator Steele-John's point, that he's not going to be put in a group home with people he doesn't know, that he's not going to be diminished as a person, that every skill that he is being taught now through his teenage years, that he's been taught as a child, that we will continue to teach him skills and open up his world and give him opportunities. I need to know when I'm not there to keep the fight up for him that he will be safe, he will be treated with respect, and he will be able to live a life of dignity. But we don't know, because at the moment we have a government behind opacity, one that said they would be transparent, but yet here we are again with just another policy area being hidden behind National Cabinet, hidden behind NDAs. I mean, we're consistently told that they can't release this modelling because it will undermine the relationship with the states, because the states are whom are supposed to have come on board to agree to funding what we refer to, or what we have known now colloquially as, foundational supports. But the great thing is foundational supports, when you ask disability groups, as we have done at different inquiries, what do you understand them to be? They come at us with a list of things they wish they were, what they think they should be, what they hope they will be. But unfortunately, we don't know what they are, because this minister and this government won't tell us what they consider to be a foundational support. So we don't know, is community health coming back to providing speech therapy and occupational therapy for kids who don't have a permanent lifelong disability but need a bit of assistance? We don't know. And to hide behind the states, I'll give you a tip, guys. Your relationship's already fractured, because the premiers are already out there saying that they do not have the funding. The health ministers, the education ministers, the disability ministers at every state level is saying that they do not have the funding to move back into the space, which, quite frankly, the states should be ashamed of themselves in the way they vacated disability as quick as they could. But we know that was a design flaw purposely put in place fundamentally by the Gillard government to get them to sign up. But we know that the states have no concept of what these supports are and what they're supposed to look like. They don't know how quickly they're supposed to be ramping them up. They have no idea how they're going to pay for it and exactly what they're going to do. And this is absolutely causing angst, not amongst just children in the early childhood stream, but that is a hugely important one, but much more broadly within the disability sector, because we don't know in a demand-driven scheme whether it's the number of participants that are going to be cut or the value of the plans that are going to be cut, because that's the only way you make cuts. And what I've found really disturbing is, over the past couple of weeks, the number of families that have reached out to me in absolute despair, having just gone through a review. And these are for children who are under school age, but also recently I got reached out to because of a girl who left school last year, who has an intellectual disability as well as other disabilities, and she has been cut back to the point that she has 1 hour of speech a month, 1 hour of OT a month. She has 4 hours of community support per week, and she was told that the level of reduction in her services was because of the new legislation. The new legislation hasn't even been introduced yet. It's not even here yet. But somehow or other, the agency is already making claims to slash plans based on this current legislation. And this is taking away an opportunity. This young girl, she's desperate to get a job. But instead of underpinning the insurance principles of the National Disability Insurance Scheme, it's slash and burning and absolutely hurting the lives, the ability to participate in community, as well as economically for those people with a disability. And shame on you for continuing to